Infection prevention and control practices are critical in healthcare and even more so during this pandemic. My name is Kari Everson, and I'm the Director of Clinical Care for Leading Age Minnesota. Thank you for joining me today to spend a few minutes reviewing these key areas of glove use in our resident care settings, including who should wear gloves, when you should wear gloves, when to change your gloves, how to put them on and take them off, or donning and doffing, and when to perform hand hygiene. Gloves help keep your hands clean and lessen your chance of coming into contact with germs that can make you sick. All staff, including direct care staff, environmental services staff, and other non-direct care staff, should wear gloves when it can be reasonably anticipated that you will come in contact with blood or other body fluids, mucous membranes, broken or non-intact skin, body tissues, or other potentially infectious material will occur. There are also chemicals that require glove use. If you're unsure if a chemical requires you to wear gloves, either contact your supervisor or the environmental services supervisor in your organization and ask. If no one is available, it is best to err on the side of caution and wear gloves. Gloves come in different sizes, so make sure you choose the right size for a good fit. If gloves are too big, it's hard to hold objects and easier for germs to get inside your gloves. However, gloves that are too small are more likely to rip. When working in healthcare, it's important to know when to change your gloves. Examples of when to change gloves include, but are not limited to, after gloves have touched substances such as blood or other body fluids. After completing a resident task. Resident tasks can include direct resident exposure tasks and indirect resident exposure tasks. Examples of a direct resident exposure task are things such as coming into contact with mucous membranes or with non-intact or broken skin, when working in areas that can be contaminated with highly infectious and dangerous microorganisms such as COVID-19 or other pathogens, before or after putting in an IV, while drawing blood, or after performing other procedures such as suctioning. Indirect resident exposure tasks include things such as emptying MSS basins, commodes, or bedpans, or after cleaning items such as urine collection containers or other resident care area items. It's also important to change your gloves after you touch a potentially contaminated surface or area. If gloves become torn, heavily soiled, or otherwise damaged, even if they become soiled or otherwise damaged when working with a resident, we should change those gloves and then continue on with what we're doing. And after working with the resident, it's important not to use the same gloves for care on two people. If you wonder whether or not you should change your gloves, you can ask your nurse or nursing supervisor, or you can just change them. Knowing how to remove or doff gloves is just as important as knowing when to wear gloves and when to change them. To remove your gloves, first, pinch and hold the outside of the glove near your wrist, as seen in picture 1. Be careful not to touch your skin. Next, pull downwards, peeling the glove away from the wrist so when your glove is off, it's inside out. After the glove is off and inside out, put that glove into your other gloved hand. Now it's time to remove the second glove, the same way as the first, by pinching the outside of the glove by your wrist. As you pull the glove off and down, it should come off over the inside-out glove in your hand. As you remove the second glove, this one should also be inside out. Using gloves will never take away the need for or replace hand hygiene. We know studies show the act of taking off our gloves results in contaminating either our skin, clothes, or both 53% of the time. If we don't wash our hands before putting on another pair of gloves, contamination from our hands can transfer to our clean set of gloves, which can in turn transfer contaminants to us, our residents, and our coworkers. So wash those hands before putting your gloves on and after taking your gloves off. Let's wrap up with a couple of glove do's and don'ts. Do work from clean areas to dirty areas. It's important not to work in the reverse. If we work from a dirty area to a clean area, we can move contaminants to places where we don't already have them. And that's something we definitely don't want to do. Do make sure to discard your gloves in an appropriate waste receptacle. Try not to touch your face or adjust your mask or other PPE with dirty or contaminated gloves. This increases your risk of infection and moving contaminants into your person. Try not to touch surfaces except as necessary during patient care. Never ever wash or reuse disposable gloves. And avoid using oil-based hand creams or other lotions unless they are approved by your employer. Thank you for spending time reviewing glove use with me today. And thank you for your work and showing up to ensure our residents have excellent care, good outcomes, and happy, healthy lives. You make a difference each and every day.